Dr. Steven Campbell is here now, and we're talking about updated AUA guidelines for localized renal mass. Thank you so much for talking with us and taking the time. First, let's discuss how the need came about to know that there needed to be updated guidelines.
Well, there's just been, through the years, a fair amount of heterogeneity in the way that patients with localized kidney cancer are evaluated, counseled, and managed. So the main objective of the guidelines is to provide very granular recommendations that the everyday urologist can use in their daily practice to help them to know what would really be the best course of action for this patient population as they're evaluating and managing them.
So let's talk about what some of those changes are.
With this guidelines update, which was 2021-22, we've updated the literature through 2021. One of the major things we've done is we've merged together a previous guideline into the main guideline. This is a guideline for follow-up after intervention. And so rather than being a separate guideline that's now merged into the main guidelines, it's also updated. We also have updated a number of other recommendations, such as our recommendations for genetic counseling. For the first time, we have recommendations regarding adjuvant therapy. One of our main recommendations relates to the issue of partial versus radical nephrectomy, and the AUA guidelines are really the only one that provides a really granular description of the criteria that should be met for radical nephrectomy versus partial nephrectomy. And we're really hoping that that will facilitate appropriate management of patients such that the ones who really need the radical nephrectomy get it, and at the same time radical nephrectomy is not overutilized. Also in these guidelines, we've sort of updated our recommendations about renal mass biopsy, which should be mostly just used in a utility-based approach whenever it might influence management. And also we've updated our recommendations about active surveillance and thermal ablation.
So when you think about the diagnosis, the treatment, the follow-up for patients, this is going to make a big difference.
Well, we're hoping this will be very helpful, again, for the urologists in their daily practice to give them recommendations and guideposts. You know, at the end of the day, you don't always have to do what the guidelines say. If the patient's very old or frail, it might change what you're going to do, but it gives you sort of a guidepost to help you to decide how to manage these patients.
I imagine for physicians that is comforting as well to know there are specific things I know I should be doing to make sure I'm giving my patients the best care as a standard.
Well, and of course that's sort of the philosophy behind all the guidelines, and I think the guidelines, the AUA has done a wonderful job with this, and I think it really is very helpful for urologists in their daily practice, but also for our residents and our fellows as they're learning the field.
Where can doctors find these guidelines so that they make sure they know what they are?
Yeah, they're certainly on the internet. If you Google AUA guidelines, renal mass, you'll almost certainly end up in the right place. But also, with all the guidelines, we provide an executive summary in the Journal of Urology, which is condensing the 80-page guidelines with all the rationale and all the ins and outs of the literature and condensing it into about a 5 or 6 page guidelines. Now, since we merged the two together, it's actually 2 executive summaries in the Journal of Urology that came out this past year.
Okay, good to know. Dr. Campbell, thank you so much. This is such important information.
Okay, thank you.